Hey, how you doing?
Hi, my name's Emma. How are you today?
Keegan, nice to meet you.
Hi, what brings you in today, Keegan?
Okay, Emma, so my son Wilbur, he's been having some issues lately. Like, he's been having a lot of seizures and stuff, and I'm just like, I'm really concerned. I don't know what to do. Like, I've been trying the medication, and I don't know. Can you help me out?
I'm glad that you've come in today. I'd definitely like to ask you a few questions to get a better idea of what's going on and
Sure thing.
what brings you guys here today. So how old is Wilbur?
So Wilbur's currently 18 months. He's experiencing some strange symptoms since birth, actually. He hasn't been meeting all of his developmental markers, and the doctor says that he has an abnormal eye movement. Like, I'm trying to, he's sleeping right now, but he's been having abnormal head movements. Recently, he's been having what I believe are seizures. Like, I mean, a lot of people say they don't think it's seizures. They say their kids may do the same, but I'm like, no, this is very abnormal.
That sounds really scary. That must be really frightening
That's what I'm
for
saying.
you.
I'm just really.
It's really hard to watch your kids suffer and feel out of control of that. Has the doctor done any diagnostic tests to
Yes,
check for epilepsy or genetic diseases?
The doctor performed a spinal tap, but he said he's looking into something about metabolic markers in the CSF. I don't know what that is, but I believe the doctor mentioned something about his glucose levels and lactate. I don't know anything about that.
So the CSF is the fluid that bathes the brain.
CSF.
It's the cerebral spinal fluid.
Okay.
And they typically look at levels of glucose and lactate. Did the doctor explain the test results to you? Typically, if the concentration of glucose in the cerebral spinal fluid is low compared to the blood, it's indicative of GLUT1 deficiency syndrome. Have you heard of that before?
I never. Is that serious?
I mean, it's not necessarily life-threatening, but it will entail some dietary management for the rest of his life, basically.
Really?
But
That's
it'll
odd.
be tricky in the beginning, but once you get used to it, we'll definitely be able to live a normal, happy childhood.
Thank you. Because
Yeah.
the doctor said that the results of the test were indicative of like genetic disease, and he didn't explain what GLUT1 transporter. Once he just told me, I just shut down. I got scared, like as a concerned father.
Yeah, so basically the disease is a genetic disease. It's inherited, and it affects the gene that codes for a protein that transports glucose into the brain. The brain prefers to run on glucose as its main energy source. So in Wilbur's case, he does not have that transporter, so the glucose cannot enter the brain. So he's not getting enough energy in his brain, which causes a lot of the signs and symptoms.
Oh my God.
Do you have any other questions about this?
I just wanted to be able to have a normal childhood like every other kid, play basketball, have fun, just play sports, like
Yeah,
something
totally
like this
understandable.
is ridiculous.
Totally understandable. I'm confident we can make that happen. Have you ever heard of the ketogenic diet?
I've heard a lot about it in the media lately, but it seems to have there's a big health craze behind it. I thought it was only for people who just want to lose weight.
Yeah, I understand why you'd be wary, and I agree there's been a lot of focus on it in the media over the past year or two. I would like to defend it by saying it's a useful treatment for many neurological disorders.
Really?
Your little one is perfectly normal. His brain just can't get the glucose in because of that transporter.
So there's nothing seriously wrong with him right now?
No. So the test results that you mentioned indicate that the glucose is flowing normally through your baby's blood, but it's just not entering the brain.
Okay.
So if he goes on the ketogenic diet, the body shifts from glucose to ketones as its primary fuel source. And the ketones enter through the brain through a different transporter. So he'll be able to take that up and use it for energy.
Oh, so there is actually some health benefits to this.
Yeah.
Really?
Yeah, definitely.
How safe is a diet? I hear everyone told he's crazy. I hear all these bad things that happen in the long run.
It's definitely a pretty extreme diet. You're basically consuming a ratio of fat, carbohydrate, and protein of 4-to-1 or 3-to-1, depending on how well he responds to the different ratios. But your child should grow and develop normally. We just need to monitor him closely and make sure that the diet is being adhered to and that he's meeting all of his developmental markers, and we'll meet regularly to make sure that that's happening.
So a high-fat diet, basically.
Yeah, and so since he's 1.5, we could start him off on some formula. There are special ketogenic formulas.
Really?
And then as he gets older, we can transition to a ketogenic oral diet.
Well, that doesn't sound so bad. I'm actually a chef myself. I'm a stay-at-home father at the moment, you know. But
That's great.
yeah, like I actually enjoy cooking for
Good
the
for
family.
you.
I know a lot about the food. I just didn't know like the science side behind it.
Yeah,
Oh,
so
really?
you'll have plenty of time to like work on this and do a lot of research.
So,
and experiment
quick question.
cooking. Sure.
I have a friend and he does the ketogenic diet and he's the one that actually told me about the losing weight thing. I've heard of this thing called blood acidosis from the ketogenic diet. Would that be detrimental to the liver cell?
As long as the diet is adhered to correctly, acidosis shouldn't occur. That basically occurs when it's not being followed properly. So as long as you're adhering to it, Wilbur's having his formula. Once we move him to the oral diet, he's sticking to the foods that we recommend. He should grow and develop normally. And we'll definitely have the doctor monitor his blood levels too of ketones.
Okay, so question, how will I know what to make exactly? Because I know like, I don't want to go certain foods he can't really handle. I don't want to do too much, you know. A baby, they're very picky with what they eat. How will I exactly know what he can handle or what to eat besides formula? He's at the age where he can eat more food now.
Yeah, I mean, so we could definitely do a little bit of formula and introduce some oral foods as well. It's like a high-fat diet, so we kind of try to emphasize learning about healthy fats, as opposed to just like strictly saturated fats, like using like avocado and olive oil and stuff in cooking. So yeah, it's a very high-fat diet. I bet a lot of the kids will actually be jealous of what he gets to eat. So do you have any other questions?
Actually, no. I actually feel really comfortable now. Thank you so much.
Hey, it was
My only
really...
issue now is I have to go explain this to my wife, but I feel way better now. Thank you.
Yeah, well, if she has any questions, she can reach out, and I look forward to working with you guys.
Thank you so much. Have a nice day.
Thank you. You too.